What has this experience been like for me? Life-changing. It really has, in some expected ways, but in some very unexpected ways too. I joined the program because I wanted to write better, and I knew I needed a more formal understanding of the intersection between theology and medicine, and that is indeed happening for me. In Farr's words, the faculty want to teach us to think, talk, and write Christianly about health and healthcare, and I'm beginning to learn to do that. But I will say, however, I kind of feel like I'm at that stage when, you know, you're cleaning out a closet and it has to get messier before it gets cleaner. I'm there, but I'm trying to be very patient in that process and use the Holy Spirit to help me move forward and to see where this is going. And I think I'm in store for a few surprises. In unexpected ways, I never would have imagined I would create the friendships that I have, friendships that I know will last a lifetime. The 14 of us in the hybrid cohort, we recognize how much we need each other, just like Alex said. We have vocations that can be so hard at times. You know, just like I said in my first answer, we all need connection, and the TMC program has given that to all of us. Particularly for me in the time together in our spiritual formation class with Martha and Margaret. I have a fair amount of prior experience in vocational discernment, but this class has taken it to such a deeper level for me. I honor the Sabbath much better now. I recognize that my vocational call professionally must include and not compete with my vocational call as a wife, a mother, a recent grandmother, a daughter, and on and on. So as expected, TMC is helping me to write better, but quite unexpectedly, it's helping me to live better too. Another surprising group of new friends for me is the fellows, people like Pfeiffer and Monica, students that are just starting their journey in healthcare. I love talking with them, and I had no idea I'd have the opportunity to informally mentor them. One of the fellows, Grip, actually thanked a few of us during a recent breakout session during our immersive week. He said, "You don't realize what a gift you all are. When we see your hands raise up during the Zoom class, we lean in because we can't wait to hear what you have to say." So that's another beauty of this program, combining, I guess, the old with the new. But finally, I think that this program is shaping me and how I see practicing as a health care practitioner differently brings me back to something in my first answer about how Jesus heals. Warren has taught us that Jesus didn't just reverse disorder and decay, rather he rescued people from hostile powers and restored people to the community. Think of the leper or the woman who was hemorrhaging. Both were seen as unclean, isolated. Brett has taught us about the Psalms of Lament, and I actually developed a lesson for my capstone project in his class this fall, designed for healthcare providers who have experienced moral injury after performing abortions. So I would not know how to write, think, and talk like this prior to this program. And I'm really learning to do that. And for that, I am very grateful.